host, Cherrelle, and we are here with our very first recorded, I'm not going to say live, but recorded episode of Skintimacy Conversations. And not only is our first episode is recorded, but we have our first guest. And I'm super excited because she's a dear friend of mine. So I'm going to let her introduce herself, and then we're going to get into how we met and all the good stuff and why she's here today.
Hello, everyone. My name is Jessica Martin, and I have been with Missy Cherrelle for about 3 years now. We met because of skin, and that's why I'm here today to kind of talk about my journey. My background, I am a nurse practitioner, but I've been in the medical field for almost 20 years. So I've seen a lot and I've done a lot. And with that being said, my experience in healthcare in general had kind of shaped me as a person and how I take care of myself. So I'm very excited about being here today so I can share my story.
And we met, to be more specific, we met at a vendor event. It was called Empower Her Circle. It was June 5th in 2022. We both were vendors there. And I think I was introducing my juice bar and my skincare services. And you were doing something similar, but you were introducing your business.
Yep.
And it's Healing Head to Toe. And she was introducing herself and letting people know who she is. And now you have a full-blown holistic practice.
Yes.
And when you are a personal trainer. And it was something else you told me you were doing too.
So the Healing Head to Toe is my baby now. But yes, so Healing Head to Toe is kind of the wellness and the holistic aspect. The personal training ties into the holistic part because you have to be physically active in order to maintain a healthy lifestyle. So I think you and I had talked about, because I have other businesses as well. The other one is Nurse on Board. I've had Nurse on Board since 2018, where I just wanted to educate people in general, like what they need to be aware of when it comes to their health. And from that, I became a doula. With doula and my background as being a NICU nurse, I work with a lot of moms and babies. And I saw there was a lot of disconnect with moms having babies, and they were not getting the care that I was expecting they should get as a minority. So Nurse on Board and Healing Head to Toe kind of meshed together because my background as a nurse and now a medical provider, I just want to educate people. That's my purpose. I really just want to educate people on awareness and being in tune with themselves.
Okay. And what inspired you to get into the medical field from the jump?
Really, it was more of me being a biological science major at Clemson. I really didn't know if I wanted to go to medical school, but that path didn't work out. And I decided to go ahead and finish up my degree in biological sciences at Clemson, and I worked in a lab. And the great thing happened, I got laid off. I got laid off. I'm like a 22, 23-year-old, and like, okay, what I want to do. And for some reason, healthcare just kind of gravitated to me. I actually end up working for a what they call now assisted living. And I decided to work there. I worked in the kitchen. I actually did med pass. And I'm like, you know what? Even though I'm not going to go to school to be a doctor, I still can figure something out for me to help people. So I decided to go to nursing school. And that's kind of how it happened. You know, I knew I wanted to do something healthcare even when I was a young girl. But when the path didn't go the right way for medical school, I'm so glad I decided to do nursing first because it built a good foundation to where I'm at now as a provider.
Okay. And so, with being a minority, a woman of color, what were some of your challenges, or what have been some of your challenges in the medical work? I know you said you saw where they weren't providing the type of care you thought the mom and baby should get as a minority, but as a professional, what are some of the challenges that you faced as well?
Just being good enough in a sense. I mean, I feel like when I was working as an RN in the hospital setting and the specialty that I'm in, there wasn't a lot of us at all.
And what's your specialty?
So, as a nurse, I was a NICU nurse, so it's neonatal intensive care. So, I work with a lot of premature babies, babies who had anomalies or birth defects. And so they had to be in a hospital for an extended period of time. And I was actually hired when I was in that department. I was number two of being a Black nurse in the department. Before, it was hardly ever Black nurses. So that was a barrier in itself. And then just always trying to show my credibility and my skill set, and having to like up, up show my skills in a way to like managers and nurse leads to say I can do it too. So that was like always a challenge, but me being in nursing school and having those challenges, it prepared me for the floor. It prepared me for those challenges, because when nursing school is very challenging.
Oh.
It's a lot of
So I was in nursing school during COVID, y'all, in my clinicals, and baby, I just listen. Just with my friend, she done heard me crying and carrying on. The medical world is not for the faint of heart.
Right.
Do not go to nurse school think you're gonna have a Stanley Cup and some cute scrubs. That is not it.
I agree.
Yes.
I agree. So I feel like me going through that journey with nursing school and becoming, evolve into this nurse, and then having challenges on the floor. Because at the end of the day, we're working with people's lives, right?
Absolutely.
A lot of emotions, and you have to know how to be a team player.
Yes.
And when you are the minority, you have to still stand out.
Yes.
So I feel like those challenges really helped me to become who I am, to see what I wanted to focus on. And I've never been a person to kind of just follow the crowd.
Right.
I'm the type of person like, I see that, I don't agree with it, so I'm going to stand on my own. And I decided after 4.5 years working as a NICU nurse at one particular hospital, I decided to travel. I decided to travel as a travel nurse, and that opened up my eyes to so many things, especially when I went to Atlanta, when I saw on the unit, it was us on the unit. It was maybe a handful of other races, and it allowed me to know like where I was. That's not what it has to be. And that when you travel and you see things, it opens up your horizon, and then you get more awareness of like how people live, how people take care of themselves. And in the healthcare field, a lot of people don't take care of themselves.
Absolutely. As a medical professional. I am tripping. When I went to work at the hospital in Asheville, I was like, how the hell are y'all helping somebody when you can't help yourself?
Exactly.
So, yeah, that's a lot of that in the medical world. And some of my most hard-headed clients are nurses or medical people. And I'm like, y'all, I mean, I understand. I get it. Working long hours. Again, I've worked in the hospital before. I'm a CNA, y'all. I'm trying to figure out if I'm going back to finish up my clinical, because I did take a break during COVID. It was just, I was finna spam from somebody, because ain't no way it's supposed to be this hard. But I still went on to get my CNA license, because I still wanted to have that experience, because I do have a caring heart, and I do like to help people in certain settings. But the politics of working in a hospital setting and overall is stressful mentally. And to see the people who are actually helping the patients, they're unhealthy too. And I'm talking physically and mentally. I'm like, yeah, I don't know if I want you working on me.
So that comes to trust. So are you really trusting what they tell you? Are you trusting when this doctor comes into the room and they talk to you about your cholesterol?
Yeah.
And you look at their exterior, and are you really trusting what they say just because they went to medical school, but are you taking care of yourself? Exactly. So I think it's a big trust factor in that respect. So I felt like for me, I wanted to be the model. Yeah. Like if I'm going to speak it, I'm going to live it as well.
Absolutely.
So that's why Healing at the Toe came about, because myself, working as a nurse, working long hours, you don't eat the right things. No. You're not exercising. So I got bigger and bigger and bigger, right? And then I went to the doctor, and I had cholesterol issues. And
this was what age?
This is back in 2015, 2016.
So you were fairly still new to the medical world?
No, actually, I've been in the medical world since 2006.
Oh, okay.
So I was in the midst of traveling. I was in my travel area.
Yes.
So I'm traveling a lot.
That's a lot.
I'm on the road a lot. And so, going to the doctor, getting a routine checkup, getting blood work, and it's like, okay, this doesn't make any sense.
Right.
Like, I'm a medical professional and you're telling me like if I don't correct this, I'm gonna be put on medicine. And I'm a person, I don't like medicine. I don't like
Right.
prescribe medicines to my clients and patients unless I absolutely have to.
Yeah.
Because I know 90% of our problem is what we're doing to ourselves.
Right.
And so I realized at that moment that I was actually harming myself, how I was treating myself as far as my inactivity, rushing, stress, food,
Yeah.
all the things, and then managing, a family.
Yeah.
And so
you're a mom.
Yes, I'm a mom,
Mhm.
and I had to kind of step back and say, okay, as a medical professional, what am I going to do to help people? But I know I can help myself first.
Right. And mentally, how was it taking a toll on you? Just being a medical professional and trying to juggle the hustle and bustle because you're a mom and a wife. But, just trying to figure all that out. How do you mentally help yourself?
Honestly, I take a lot of resets. I literally take a lot of resets in the sense of like, if I'm getting overwhelmed or I'm in situations that's not serving me anymore, I back away. Like, I don't second guess it because I feel like life is too short to second guess anything. I recently resigned from a position that wasn't serving me anymore, and that was the best decision because I feel like at the end of the day, our mental health comes before everything. And if we're not 100%, balanced, we can't give it to anyone else, and I can't serve my community.
Yeah. And I also feel like that's God too. When it starts tugging at your spirit, I always tell people, I don't care what it is, whether it's career, relationship, whatever.
Yes.
I need clarity.
Yes.
And anytime something starts pulling at my spirit and I start getting a little, I'm like, oh, okay, let me take a step back because this ain't it.
It's not.
Yeah, at all. So
agree.
that's good that you listen to yourself, you listen to your body.
Yes, I do.
Yeah.
And you have to know your body, especially if you want to heal your skin.
Right.
You have to listen. I mean, I dealt with acne.
So speaking of, so let's kind of backtrack for a second before you get started. We met in 2022, and you have been dealing with acne issues for quite some time.
15 years old.
Wow.
My mom took me to get birth control pills, and it helped. I didn't have any more acne. So I stayed on birth control pills up until literally right before I turned 40 because it helped.
Right.
I wasn't at high risk for breast cancer. Obviously I'm a professional, so I'm gonna go get my mammograms and do the things I need to do. But it helped. And I had the type of acne that was hormonal. And everybody doesn't have that type of acne, but that's the type of acne that I had. And that's the only thing helped. And when you learn your body, you learn what triggers.
Yes.
And what triggers the hormonal response to your body. So when we met, I was already in a good spot. I didn't have any outbreaks because I was on birth control, but I knew I wanted to get off of birth control.
Yes.
That was my path. Like, I wanted to get off. And then when I started coming to you, it was like, okay, I know I'm going to have outbreaks, but we're going to get through this.
Absolutely.
And you got to have patience. You got to have patience. You got to be willing and be receptive to what the professional is telling you. And you got to be transparent and let them know what you're dealing with.
Correct.
Because it's a team effort.
Yes. Okay, so I know you said you were put on birth control at a very young age. And I know that's a common thing for people who suffer with acne, and especially with yours being hormonal. So kind of tell us why you decided that after all these years, why did you not want to take birth control anymore, knowing that it could possibly cause a rift in your skin, being that you struggled with hormonal acne for so long, what made you make the decision? And tell us about birth control, because I have an issue with that as a licensed esthetician. Why that's the first thing the doctors put these young girls on and what it does to them in the long haul.
Honestly, every body is different as far as like how chemicals are metabolized in your body.
Yeah.
So birth control in a nutshell basically suppresses the follicle cells in your reproductive tract. So if a woman is having unprotected sex, it's actually making it seem like you're actually pregnant.
Okay.
So with that being said, the shedding and the lining of your uterus, those processes are altered, and so you don't have those hormonal fluctuations in your body.
Okay.
And so for me, I had hormonal acne, so I didn't have those constant fluctuations where I had an outbreak around my period. Everything was everything was pretty stable.
Yeah.
However, I really don't like taking medication.
Right.
But when you are female and you want to have nice glowing skin, you sometimes, play the pros and cons of things.
Right.
But as you get older and get wiser, and me doing more research on like synthetics and things that's made in the lab and medications and side effects, I decided to come off. And as far as a woman, especially, when you're premenopausal, menopausal, and postmenopausal, it really can disrupt like how your body kind of reacts to like menopause symptoms. And even increasing your risk of breast cancer. So all those things in a nutshell, I just didn't want to put my body at risk. I would rather just do the work and get my skin balanced without using the synthetic pills.
Right. Okay. So for young women though,
Yes.
like what are some recommended? Because I've had girls come in here as young as 15 years old and they're experiencing hormonal breakout and it's horrible, but the last result is to get on birth control. So what are some alternative things? I mean, because I know your body's going to naturally go through some stuff.
Yes.
But I also tell my young clients, you got to watch what you're eating too.
Yes.
Because your body is naturally going through hormonal fluctuations, but eating all the sugar and all this processed food is not helping. So we got to kind of take a step back and look at a more holistic approach and figure out what we can actually do to help ourselves where we don't necessarily have to go to birth control for the first thing.
I think the main thing is getting a great regimen.
Yeah.
I didn't realize I needed a regimen until I got older.
Oh, really?
Yes, and people like, oh, like I don't even wash my face. And when I hear that now, I'm like, it needs to start as a teenager. Like those type of educational things with your moms or aunties or grandmas. It needs to be a foundation. Everything's a foundation in the home.
Right.
So if you're not getting that type of like exposure, then how you really gonna know that how you need to take care of your face?
And it's almost cultural.
It is.
Because with African American women or women of color, I rarely hear them say, my mama or my auntie taught me how to take care of my skin with a proper skincare regimen. It's always Vaseline, or for the 90s girls, Noxzema, or what's the other one? What is Proactive?
Yeah.
Those were like the main things, but nobody really talked about like a full-on skincare regimen that was effective and safe for your skin. And another thing I hear young girls or just people in general say, especially from the dermatologist, they put them on retinol or tretinoin or whatever. And I'm like, well, it's not really. I mean, you can use it and it can be effective in certain, if you use it in certain percentages. But most of the time, it irritates my client's skin. And I'm like, okay, well, that was defeating the purpose of putting them on something to help them with the acne, because now your damn skin burnt off. So, you know what I'm saying? And even down to the hyperpigmentation after the breakouts. It's like people of color have to really understand their skin and where their issues are coming from. I can guarantee y'all about 90% of my clients that I see have internal health issues. And I don't give a damn what y'all say. It is coming from inside out. There's a small percentage of women who experience acne that is truly superficial acne. Most of the time, it is hormonal. And that means something in your body is out of whack. So I always tell Jessica, okay, did something change? I know we're going through, we season, we're going to our 40s. So what does that mean? What the hell is going on with your body to where your skin is breaking out? And I'm also going to a deeper segment later on and talk about menopause, perimenopause skin. There is a thing with women around the age 35 to 40 where they're experiencing perimenopausal symptoms and they don't even know it, but it's showing up in their skin. So we're going to talk about that at a later time, but back to you, Jessica, when you decided to get off birth control, now y'all skin did go crazy. And I'm going to insert some pictures. Because what you see right now is not what the hell we started it, okay? We had to go through some stuff. So kind of talk about how that weighs on you too when you are being healthy, when you are being intentional, when you are coming off of the medications and doing the work and working out, and it's still not working. Well, it works, it just took some time. It took us about a year for her to go through this transition of coming off birth control and then going into her natural skincare approach, as far as like letting her body naturally do what it does, and how we got to this point where your skin is all right.
Wow.
I would say it's beautiful at this point.
Oh, well, thank you. Thank you. I would say you got to know it's going to work. You got to, like, I had to trust that it's going to work. I had to go through the growing pains. I had to go through having outbreaks and having painful acne on my face. And I just had to be patient. I just feel like you just got to do the work.
Yeah.
Like, you just have to be patient and know that it's not going to happen overnight. You're not going to come and see this great esthetician and think that your skin is going to be wonderful. Like, it's a team effort. It's a team effort.
Yeah.
And it really took a year. And finding the right modality that worked for me was the key. And that's what it's about. So don't just give up because you buy a skin line and it is not working.
Right.
Like, try something else. Like, be open about stress. Be
open
about
and honest.
And honest about what you're eating, what you're drinking, things like that.
Okay, and speaking of what worked for you, okay, so we know products work, but I'm big on not just relying on a product or a treatment. Because again, throughout the years of me being an esthetician and servicing women of color and understanding our issues are not necessarily the same as our counterparts. A lot of times our issues are coming from internal.
Yes.
So I'm big on it. So throughout your journey, our journey together, me helping you, we did some lab work. I think we discovered your vitamin D was low.
Vitamin D.
Yeah, please give us some vitamin D. Lord have mercy. People of color, we need vitamin D, and most of us are deficient, and that can disrupt your skin. Not only that, though, what else could vitamin D disrupt as far as hormonal health? Or health in general? Just
health in general.
Okay.
Your body is not, your biological processes are not going to work efficiently if you don't have good vitamin D. So like vitamin D is very important. There's so many vitamins that your body needs.
Yes.
Especially like women of color, we have our melanin. So we don't absorb the skin. The sun,
right?
Like other races. So we have to get a little extra, and then keep a check on it.
Yeah, absolutely. So do you recommend? How often do you recommend getting your lab work done?
Honestly, I recommend people getting their lab work at least every 6 months to a year.
Yeah. Why don't they say like longer? I'm like, that is crazy because things can change in a year.
Things change. And, if you're very healthy, you take care of yourself, you don't have any issues with blood pressure, cholesterol, diabetes, at least once a year.
Yeah.
And I would get a full panel. I know a lot of doctors and offices don't want to order all these labs.
Yes.
You have to be an advocate for yourself.
And I'm going to tell you a little tidbit. I start telling my clients, because what I've noticed is if a client comes to me and says, I'm wanting to get pregnant, I'm on these hormonal, whatever they're doing to get, fertility or whatever. They have issues with fertility. They may be going through, fertility treatment.
Yes.
I tell my clients, whether you're going through fertility treatments or not, go in the doctor's office and say, I'm trying to get pregnant and I need a full panel.
Yes.
That's the only way they're going to give you a full panel without a fight.
Yes.
So I tell my clients, don't go in there and say, I want to do I just want to get a checkup. No, go in there and say, I'm trying to get pregnant. I'm of a certain age and I want to check, what my possibilities are. Right. And usually they'll run a full span on you. That's what I've learned along the years. Like, if you just go in there and say, I want to get a checkup, they're going to give you bare minimum. And this is where becoming an advocate and learning the trick of the trade. Have you some good friends and some high places. This is where that all comes into play. If you really want to get a thorough check on yourself, y'all go in there and say, I'm trying to get, I'm not. But I will go in there and say that because I'm not speaking on myself. I ain't trying to have no kids. But I will go in there and say, me and my husband trying to have a baby child, and I want to get a full lab. So for real, that's what you guys need to do if you want to get an in-depth lab done yourself. So also, I want to ask you, I know you said you did a lot of changes and stuff like that. So I know you worked with a herbalist. Yeah. And so kind of tell me about that, because girl, you gave me a detox one time. Although I thought it was poison, it worked the hell out of me, and I thoroughly enjoyed it.
So I work with several. I have one here in the upstate. She's awesome. So if anybody want any information, if you're in the area, I know Courtney would actually put the information in the show notes.
Yes.
But I have someone that I work with in Atlanta, and he's been awesome. And one of the detoxes that she's speaking of, it really just cleanse your blood.
Yes.
You have to get down to the blood. You have to cleanse your blood because you got to think about your blood is like functioning in your body constantly, going through your heart,
Bringing
going through those,
nutrients.
going through those vital organs.
Mm-hmm.
And if you are dealing with acne or anything with your skin, your blood has to be purified as well. So detoxing is very important. You can do simple detoxes where you refrain from certain foods and drinks to kind of get your body used to it. But the main detox and what she was speaking of is your gut. Your gut is like a trash can.
Yes.
So if you're not cleaning your gut and you're not having normal bowel movement,
listen, because if another person come here to my they ain't shit in a week.
I know
there is a problem. Like, please tell these people that's a problem.
Okay, it's a problem. And I'm gonna say it like this. So this is what I educate all my clients and patients on.
Yeah.
You have a trash can in your house.
Yes.
Okay. And you had a cookout. Okay. And that cookout, you had a lot of food, and everybody put all their plates and everything in the trash can. And the next day, you or your husband take the trash out, it starts smelling. And then the next day, it starts smelling. Just think about this, your insides. All those fumes are turning into toxins. So if you're not using a bathroom, your motility in your gut is slowed down. So you're not able to effectively have a good bowel movement. The normal pattern for having a bowel movement, every time you eat something, and it could be a smoothie that has like your vegetables in it or have your fruits in it, or if you have even a small meal, you should have the urge to use the bathroom in a couple of hours.
Right.
So if your client's telling you that they haven't had a bowel movement in over 24 hours, that's a huge problem. Because you're allowing toxins to change your DNA. So now you have to reverse it. Now you have to get the toxins out and now build up a good, healthy immune system. So that's why it's so important. Your gut health is ultimately where you start. So that's where I start with my holistic clients is gut health. Nutrition is awesome. We're going to talk about nutrition, but if your gut health is not on point,
it don't matter.
It's not going to help.
The lining, your small intestine is where you absorb your nutrients, right? So this is what my anatomy skills gonna come in and girl, I had an A in anatomy. But yeah, so your gut health is it's so important because it's where you absorb your nutrients, right? But if you clogged up and backed up, you're not absorbing nothing. I don't care what you're eating. So you have to cleanse yourself out and rebuild that lining of your gut so that you don't have a leaky gut, because it can cause all kinds of issues. And we can go into another segment of that, talking about leaky gut. But if you don't have a good gut to absorb the nutrients, you're not getting anything anyway. And people forget your skin is the largest organ of your body. It kills me. And I almost have a love-hate relationship for the industry I'm in because everything is so superficial. Everything is a product. Have you tried the new thing? And I'm like, girl, what the hell is the product going to do if your internal health is off? Because I can tell you this, if you are unhealthy, your skin is the last thing your body is concerned about. Your body is going to keep you alive. So it's going to take care of your heart, your liver, your lungs, all the important things, your brain, before it gives a damn about your hair, your nails, your skin. Like, those are accessory organs, I would say. It'll take care of the biggest thing to keep you alive before it cares about your skin glow. So you have to take care of yourself internally. So
I love it.
Yeah.
And then the toxins, when you're not expelling those toxins and it changes your DNA, you put your more at risk for cancer. And people don't want to, admit to it.
Yeah.
But, a lot of us have different cancers. You have men who has prostate cancer. You have women who has breast cancer. You have lung cancer, pancreatic cancer, cervical cancer. And if your body is not healthy in a healthy state, you're constantly changing it. And so your body's trying to adapt to it.
Right.
So a lot of things, at the end of the day, we kind of bring on ourselves. So if you're not properly educated on what you need to do, then when you go to the doctor and they say, you know, you have this devastating diagnosis,
Yeah.
I want you to look at your life. I want you to take a look at your whole
Cause we got to
life.
step on some toes up in here.
I know.
Cause
I know.
you know, prayer can only get you so far.
Exactly.
If your ass ain't doing the work. Yes.
The work
Like, you know, I understand praying and it works and all this stuff, but you
Right.
gotta do some work. You gotta come out that old mindset of, you know, well, grandma them did it. No.
Yes.
And diabetes does not run in your family.
I know.
It's the eating habits. Now, you can have some genetic disposition because we talked about
type 1.
your mom having acne issues and skin
Mhm.
issues, and that can be a genetic disposition. But your lifestyle ultimately can switch on or switch off those type of genetic genes. So again, we may be born to certain things, but ultimately our environment, our lifestyle, our mindset can change the outcome of how things are projected into.
Absolutely. Absolutely. I love it.
So yeah, I just tell people that, you know, skin is more than just a superficial thing. So speaking of, now that we've gotten your skin in balance, although it'll cut up sometimes,
Yes.
but pretty much, and that's why I tell people, don't ever think that once we get your skin right, that it's just gonna be, you know, smooth sailing for the rest of your life. Because things change. Like our body change. I say your body changes every decade. About every, you know, your 20s, you just living free, and however, your 30s, you kind of like, okay, girl, now we got to kind of roll it in because we can't do shit like we used to.
Yeah.
Now in your 40s, we really got to take care of ourselves for real. So for you as a wife now, because you recently got married, hey King, you recently got married, you're a mom now, your son is getting ready to graduate, he's active in sports, and you were once traveling, now you kind of settling in here, but you're still running all three of your businesses. So what does a day in a life typically look or a week look like for you? And how do you tie in your self-care, your skincare? Because a lot of people say, well, how am I going to do all this? That's the main question. People are like, well, how do I do all this? And I'm like, child, listen, Carl got 28 hours. It says 24. But what is it? I'm serious. I swear I'm working with about 28 hours out of the 24 hours we get in the day. So what do you typically do for yourself?
Well, honestly, I'm going to say this. I had to come to realization that I could not work for an employer.
Now, hold on.
I know.
Because people going to run with it. Let me tell you something about being an entrepreneur. It ain't for everybody. Now, me and Jess, we done did some things to keep ourselves afloat.
Yes.
She got something that she can go back to as a nurse.
Yes.
She can get whatever job she want to get. Okay? And she can still run her business. Yes. Now, don't go quitting your damn job talking about you finna be an entrepreneur. Like, you gotta have a whole vision.
Yes.
I'm sorry. Go ahead. I had to just let people know that.
Yes. And I want to say, for me to be balanced and have a regimen, I knew I had to eliminate things that was impacting my overall health. And me working for someone and utilizing 8, 9, 12 hours of my day with an organization that I know is not my true purpose, I had to remove myself from that situation. Okay. So how I keep myself self-balanced is I start out every morning between 4:30, 5 o'clock, and I wake up and I pray, I meditate, and I try now to get back in my routine that I had before I start working for somebody, is to do things for myself.
Absolutely.
Even if it's, you know, coming to get a facial or going to the gym, you have to think about yourself first, because if you don't show up for yourself first, you can't be there for your husband or your children. Right. So I feel like having a routine and sticking with the routine is the only way that it works for me. You have to be disciplined.
Discipline.
You have to be
That's the word for the day.
And you have to be consistent.
Yeah. Yes.
And life is going to happen. And you mentioned something about, you know, my skin, you know, can kind of act up a little bit. That's life.
That's life.
Life is going to happen to everybody. Unforeseen situations going to happen. And we have to kind of roll with the punches and keep going. Yeah. Right? We got to keep going. And so when my skin want to kind of act up and I send you a text, I'm like, okay, we gotta
get on top of
get on
Yeah.
top of it. But that's how life is. So I feel like just being consistent, having a regimen, taking care of yourself, and honestly, like I wash my face day and night.
Yeah.
Morning and night. I feel like the basic foundation of my skin, cleaning my face morning and night, not going to bed, not sleeping on a dirty pillow, like those little things add up. And when you do that over time, now my outbreaks now are not that bad.
Yeah.
And I kind of know, like, okay, I'm getting something. I know I need to jump on it.
Right.
Versus become a problem, we got to start from scratch.
Right. And Jessica, just to kind of clarify, she is my acne client. So she is on Face Reality. I'm a Face Reality rep. Those are the products I use for my acne clients. And we may have to change and adjust some stuff along the way. But essentially, I always tell my clients to start from within. Working out, detoxing your body, hydrating. Like, people have an issue drinking damn water. And I'm like, your body is over 60-70% water.
Yes.
And like we talked about with your blood, water is the basis of your blood. And if you don't have enough hydration in your body, your blood is not going to be able to move and take the nutrients and take the waste out of your body. So it's like people have an issue just drinking simple water.
I know.
I have to meet people where they are. I understand stuff doesn't change overnight, but it's kind of like, well, what can we do? Like, what can we become consistent with today? You know what I'm saying? And drinking water is definitely one of them. And like you say, being disciplined in that. People like discipline. They want to see all the changes. They want to get all the glory of having good skin. I can't stand some. I love when y'all recommend people, but I almost can't stand it because people don't understand what the hell we done went through to get her to where she's at a good balance for herself. And she has a realistic perspective of her skin because she understands life happens. I'm a medical provider. I'm a mom. I'm a wife. I have all these roles that I'm given to. And at some point, something ain't gonna happen. So when I start feeling that way, let me reset. Let me get back to myself. Let me retrain myself where I am right now in my life. And let me get back to being me so that way I can then pour from a full cup rather than an empty cup. So with that being said, what does self-care and success look like for you now? At your age, you a woman of a certain age, but you're still, youthful. So what does it look like for you now?
I'm just grateful. Like I'm literally grateful for all the ups and downs, and it looks like that I have become an individual who knows that at the end of the day, I have to take accountability for my actions. And now I can own up to the decisions that I make. Even if it's not a good decision or if it's a great decision, you have to own up to those things. But as of right now, I feel like where I'm at right now, I'm just grateful for all the opportunities, everyone I've met along the way, meeting you, meeting other people in the healthcare industry, because it kind of molds who you are.
Absolutely.
And it allows you to become who you're, because we're all still becoming. We're all growing.
Yes.
So I'm just grateful for this journey. I'm grateful that I didn't just succumb to like, oh, I'm just going to be on birth control or I didn't have the knowledge. At least I'm grateful for the background of being in the nursing field. Being in the healthcare industry. I'm blessed in that respect because I have that foundation, and that's the reason why I want to educate more people on things that I've learned and obtained through this journey so they can be more aware and they can do their own research. Because we can give you information all day, but I would expect you want to do your research because this is your life. This is our life. And we can just give you our perspective and our journeys, and hopefully it may change your perspective on what you're thinking, even when it comes to just washing your face in the morning with good products.
Right. And just like kind of we talked about with the doctor being unhealthy, it's like, why would I listen to you? I need to go do my own research. You may be telling me what the labs are saying, but you obviously are not applying the lifestyle that you're telling me to live. So it's like, I am big on going to do my own research. Actually, that's something me and Joe argue about quite big. It's like, he tell me I question everything. I do.
You have to.
Because it's like, why wouldn't I? Like, yeah, I might can take your word, but I'm going to formulate my own perspective. Like, what you go through may not be the same as what I go through, but we can relate on some level. You know what I'm saying? I may not have struggled with acne, but I have struggled with high blood pressure. So it's kind of like, although our struggles are different, we still have to be consistent and disciplined enough and accountable enough to say, okay, I got to change something.
Right.
Because something is not right. And my body is telling me something is off.
Right.
And you have to learn to listen to yourself. And a lot of people do not do that at all, especially in this, I feel like in this world we live in today. Everything is so superficial. Everything is so for the look of it.
And fast paced. Like,
Yeah.
Paced.
Yes.
You wake up, you go to work, you're on a hustle and bustle all the time. Before you know it, it's 5, 6 o'clock in the evening.
Yes.
You're trying to rush and eat something, you're trying to grab something, and that's your day. So think about it. If you're doing this day in, day out, weeks, months, years, and then your body is not in tune and you have blood pressure issues, what have you been doing with your life this whole time? So it's kind of eye-opening, and I want people to be more attuned to like listening to your body, because your body gives you signs.
Yes, it does. Absolutely.
Like little subtle things. It may be a slight headache that you've never experienced headache.
For me, I can always tell when something is off. I get a headache, and then I get a blood pressure vessel bust in my eye. It it happens every time. Anytime I'm not paying attention to myself and I'm just going and company. Because again, going back to being an entrepreneur, I don't get paid to be off.
I know.
So for the longest, I lived a life of I gotta get this money. But is that healthy?
Right.
That might have been okay for me at 25, but at 38, I'm like,
I know.
Hell no, something gotta give. I can't work like this for the rest of my life. So I have to then say, okay, well, what does success look for you right now? Look like to you right now. Like, where do I want to be?
Right.
Even in being my own boss, what does it look like for me now? Because now it's causing an issue with my health and hell, my skin too. Because even me, like if I'm working all day with clients, listen, I'm gonna go home and do my regimen, but it's gonna be a rush job. And I have to stop doing that. You know what I'm saying? Because I have to live the life I'm telling you guys to live. So I feel like a lot of us lack that, and we lack that accountability with ourselves. But we have an allegiance to everybody else, and I don't understand that. So I want to know if you could speak to your younger self from today. If you could talk to your skin from 15 years old to today with the knowledge you have, what would you have told yourself back then?
Don't listen to other people. Listen to yourself. Because your intuition and your own thoughts and mind actually is your conscience telling you what you need to know. Not saying you shouldn't take the opinions of people and kind of see how that could play out in your life, but just a doctor telling me, oh, just get on birth control, you'll be fine. It's okay. That's his opinion. But if your gut doesn't be in tune to like actually being receptive and want to do that, and you're second guessing it, then you need to like listen to yourself.
Yeah.
Take time. Don't rush it. Like you can get a prescription any day of the week, but you don't have to fill it.
Right.
You don't have to take it. You can do your research and say, let's weigh the pros and cons. Let's weigh, if I take something for my skin, what are the side effects? Do I want to embark on these side effects potentially? Or do I want to take a different approach first? Do I want to see if this other approach is going to help? And if it don't, at least you have a backup.
Right.
So I would just tell my younger self, like, just be patient with myself, listen to myself, be respectful of people's opinions, but know that ultimately this is my life and that I'm going to make the decisions for me. That's based on what I want out of life, especially when it comes to my skin and how I want to look. Because when you're in the healthcare industry, people look at you first. They look at your face. And, at the end of the day, I want to make sure I'm presenting myself in a way that I look healthy.
Yes. Oh, absolutely.
Yes, and if my skin is, with a whole bunch of blemishes and acne, then you may say, well, she's not healthy,
Why should I listen to her?
Why should I listen to her? So at the end of the day, just being patient with yourself, going through the growing pains, finding somebody who's credible
Mm-hmm.
and knowledgeable on a lot of things, because there are great professionals out here that do skin. There's great dermatologists out here,
Yeah.
but sometimes they're just one sided.
Yes.
And so I think that's why me being holistic, I look at the whole picture. And that's what
Yes.
holistic is. It's whole.
Yes.
It's not just looking at westernized medicine or holistic. It's looking at what's best for you, because everything doesn't work for everybody.
Right, right. And so, lastly, as a Black medical professional, kind of going back to, having access to resources and things, what are some of the things you would like to see more, or what are some of the things you would like to offer in your own business to other medical professionals or just people of color who could potentially be patients of yours? Like, what access to certain health aspects do you think you would like to offer them?
I would like to offer them the ability to realize, like, you can heal yourself.
Mm-hmm.
You can literally heal yourself from head to toe, and that's my business, healing head to toe.
Yes.
And I want to offer people the opportunity to do a consultation with me.
Okay.
Speak with me about their health, because it's one of those situations where you have to really sit down and take time with people, and actually get their health history, their family history, where they're eating, what they're not eating, and going over like what your body is made up of.
Mm-hmm.
And I want to be able to offer that service to people, because a lot of people don't even realize the small things that they're not doing can change their trajectory in their health in general.
Mm-hmm.
It could put their body in a whole different light, and then they start feeling better. The fatigue kind of goes away.
Yeah.
The mood swings kind of go away.
Ooh,
a lot of things just kind of start going away when you get kind of balanced. So I want to offer the opportunity, anybody who's interested in a wellness approach, holistic approach, just getting healthier in general. Like, this is what I do. This is my passion. I mean, I've been through it. I did the work, and now I want to educate everyone on you can do the work too. But you got to be willing. You got to start here. You got to make the commitment that, I want this, and nothing is going to stop me.
Yes.
Nobody's going to stop me.
Yes. All right, Jessica, I know you're a busy lady, so we're going to kind of wrap this thing up. So tell people where they can find you at, if they're interested in your services or just wanting to meet with you to do a consultation. Tell them all about where they can find you at and come see you.
All right. Well, you can find me very easily because I do telehealth. And so everything is pretty much virtual. My business is Healing Head to Toe. You can also find me on social media, also Facebook and Instagram, and it's actually Healing Head to Toe. You can send me a message. You can also give me a call. I'll make sure Courtney has my information as far as giving me a call. I'm very personable. I'm personable with all my clients. They can call me, text me at any time. So I would like for people to know you can reach me with my business. And also, if you want to see me personally, I'm also in Spartanburg, South Carolina. I'm inside the Spartanburg Athletic Club, where I also do personal training, and I also help people to lose weight right now. So that's where I'm at. I hope, if you're looking for somebody and you've been thinking about it, maybe you'll try me out.
Yes. And you guys, if you have any questions or any topics that you want us to go more in depth with, because I feel like we hit on a lot of stuff, and I feel like we may have some questions that people want to go more in depth with. So please email us. I'll put that in the description box. I'll put all her information in the description box. Please comment down below, like, share, and subscribe. And we will see you guys next time. Let's get intimate. Bye.